Well, after what has been an incredibly difficult year for so many families, it is only natural that we want to get together with our loved ones this festive period. But the virus is still extremely dangerous, and meeting up with other people is going to carry an element of risk. I'm Kate Garraway, and I'm here at the Royal Society of Medicine to try to get answers to your questions. We're going to hear from top medical experts who can give you the science behind the guidelines to help you plan for the safest and best festive period for you and your family. Lovely to meet you. I want you to start by saying a little bit about who you are and what you do and how it relates to people being able to manage COVID.
Okay, so I'm Chris Van Tulleken. I'm an infectious diseases doctor at University College Hospital in London, and I work at the Hospital for Tropical Diseases, which is the infection department of that institution. So I treat people with a wide range of infections, including a lot at the moment, COVID, both inpatients and people who've had COVID. I'm also a scientist at UCL where I study viruses. I do molecular virology, so how viruses get inside our cells and dismantle our immune system and infect us. And then I'm also a broadcaster, so I present a children's program called Operation Ouch, and I do a lot of broadcasting for the BBC. I think a big part of my experience was my identical twin having quite severe COVID, where he came into hospital and we had to, he had a heart, his heart became inflamed and went into an abnormal rhythm, and we had to stop his heart and restart it. And that's happened for him a few times. He's now on a cocktail of drugs to keep him in the right rhythm, and he's still very exhausted by it. So I suppose he falls into that. He might deny this, and maybe I'm being a bit indiscreet, but I think he wouldn't mind me saying I think he is falling into that bracket of people that we are. Some people are describing as having long COVID or a post-viral fatigue syndrome. Yeah.
So what can people do to protect themselves? What can people do? Because it's been going on for a long time, hasn't it? And we're hoping that at Christmas, after what feels like a lifetime, people will be able to start seeing more of their loved ones. So what would you say in terms of infection spread, and as a doctor, would be the best way to approach that?
Maybe if I can answer this question quite sort of personally. If someone you live in a house with, if my wife has COVID, do you know what the chance of me catching it from her? Bearing in mind we share a bed and we share cutlery, and we've got young kids passing filthy glasses everywhere. What do you think the odds are that I will catch it off my wife?
I would say high. I would say 100%. That would be my instinct from what we've heard.
That is what most people would say. It's about 35 to 40%. There are a few studies show higher, a few studies show a bit lower, but it is not a dead certainty. So what that tells us is it may be that some people are intrinsically resistant, but we know that those people later on some other occasion will go on to get COVID. So it's not like they have some natural, all of them have natural resistance. So what that shows is it is to some extent avoidable. And what you have to do is remember that every single little thing you do to avoid catching this virus counts. So if we think of your standard day as a bit like a game of Russian roulette, but there are many, many chambers in the gun. And what you want is as few bullets in that gun as possible, obviously. And every time you don't wash your hands, or you stand within 2 meters of someone, or you don't wear your mask, or you occupy a confined space for a prolonged period of time, if you like, you're putting another bullet in the gun. But the point is you're rolling a many-sided dice is maybe a kinder analogy. One of the things I think we all do is we go, well, if I've taken the risk of going to the pub because it was allowed on this day, I might as well give up all other things that I'm doing. And actually, if there's a very precious occasion like Christmas where you really need to see someone who maybe you're not going to see again, some very loved person that it might be your last time together with them, if you have an older relative, if you do that, it doesn't mean you should abandon everything else you do. You should double down on every other precaution you're taking. So what I would say is we know how this virus spreads. There is an academic discussion about true aerosolization and the size of droplets and droplet nuclei. But we know that in my snot and my spit, if I have symptoms or if I don't have symptoms, there may be particles of virus. And so any way you can imagine that my snot or spit can get into any of your body cavities, you can catch this virus. You can catch it in your eyes, your nose, or your mouth. So if I spit on the table between us and you touch it and you rub your eyes, that's how you can catch COVID. So don't do that. Don't touch surfaces and then touch your eyes. Don't touch surfaces and then eat lunch and put your hands in your mouth. Wear your mask wherever possible, and then some of the droplets. As I talk, in these bright lights, actually, you can see, probably from the way I'm lit, you will see a spray gradually aerosolizing from my mouth. And 2 meters away means that most of it falls on the ground and only a very tiny amount gets to you. If you wear a mask, even less gets to you. So adding up every possible thing you can do at every moment is what protects you.
It's a little bit like when people say, I've blown my diet, now I've had a chocolate bar, so I might as well
Exactly.
just, carry on. That's not the way COVID works.
That is exactly
go
right.
back on the celery and keep going all
Get
the way
back
through
on
the
the
rest
horse.
of the day.
I think that's a perfect analogy.
Yeah. If you or a family member thinks they've already had the virus, what are the risks there in getting together with them?
My rule is unless I can see on my computer system in the hospital your antibody test result and your PCR test result with a date, I don't care what you tell me about your status with this virus. So many people think they've had it and they haven't. So many people think they haven't had it and they have. We have no idea. And even lots of people will say as a shorthand, oh, don't worry about me, I know I had it, because maybe they did have a period where they lost their sense of smell in July. It might be for a completely different reason, who knows? So I think treat everyone as if you have it and as if they have it. That is the safe way of behaving, even within your Christmas bubble, even though you are allowed to do other things. I think that is the basic way of behaving.
Chris Whitty threw a little curveball in on everybody else's excitement, the idea of these 5 days at Christmas, by saying, don't hug your grandparents. Do you think that is good advice from him?
Well, Chris Whitty works at my own institution. He is my former boss, and I would agree with everything he says about everything in principle. He's an amazing clinician and scientist. And I would say, yeah, don't hug your grandparents. If your grandparents are extremely young, they think they've already had it, and they are desperate for a hug, and you've already had it, and you're really clean, we could find a way for you to hug older or vulnerable family people if you want. It's not forbidden. But I think the starting premise is don't hug your grandparents. I think that is a really smart thing. Probably don't do a lot of hugging. This is a virus that in part has spread through our national fear of embarrassment, our reluctance to refuse to shake hands, to hug, our fear of seeming neurotic or prissy or self-obsessed. And I think everyone has to adopt their own personal tactic to sort of head off all this. So I sent my family an email going, here are the rules that I think. Now, I have a slightly more authority in my family because I'm an infection doctor. But if you have your parameters laid out and you say to everyone, so you all know, I won't be hugging you because I love you and I don't want to give you coronavirus and I might have it and not have symptoms, that's a way of wrapping it up as protecting them, even though you might actually be worried about catching it yourself. So my rule is I hug my wife and I hug my twin brother because I have seen his results on my computer system, and I guess he needs a hug more than most people, and I want to give him a hug. So those are and I hug my kids. And I don't hug my parents. My parents had it, I'm sure. I still don't hug them.
Very strong, very strong. Christmas is coming. People want to take the opportunity to meet loved ones that they haven't seen for a long time. What is the best way they keep themselves safe and perhaps more vulnerable relatives in the run-up to Christmas? So
when we all go into our festive bubbles, the nightmare is that someone imports. What will wreck Christmas is if someone imports COVID into that bubble, because then you are all quite intimate. So in the run-up to Christmas, it's really smart to kind of double down on the precautions we should all be taking. In my life, a lot of people around my age, they've got kids, they think they've had it, they're starting to just lightly propose, infringements of rules. You know, we can dress things up as childcare. We can meet outdoors, maybe, and we can sort of accidentally bump into people. And I think being really strong about all that kind of stuff and going, look, I know Christmas is coming, but that's more reason to stick to the rules, not a reason to start bending things. So keeping your distance, mask, the 2 meter rule. Being absolutely clear on not meeting people and taking loads of care on public transport, hand washing, all the things we should be doing already. So doubling down on your care in the period up to Christmas is really important. And then being prepared to scupper Christmas if you are symptomatic.
That's another one of the questions, you know, what happens if somebody that you've bubbled up with, you've talked to, you've made your family decisions about who's going where. Bought the turkey, someone suddenly gets symptoms.
Everyone's just got to be a good citizen and a good family member. I mean, you don't want to be the person that gave your family COVID at Christmas.
How should we stay safe while travelling? A lot of people crossing the country, going home or visiting other relatives.
Travel's your major risk. When you get to your location, you can get into your habits, you know where your sink is, you know the people around you can have honest conversations with them. Travel is your moment to catch the virus. You're with large quantities of strangers. You can't open windows on modern trains. So don't be shy of being, even now you are regarded as something, you know, you do get the odd look if you know, I wear purple lab gloves if I go on public transport, and it reminds me not to touch my face, and it reminds everyone around me that there's a virus around, and I look a bit odd. But for every one person sort of going, you're being a bit over the top, aren't you, mate? There are, I think, 10 people going, oh, this is good. I'm pleased that he's behaving like this. So wear gloves if you can, bring your own hand sanitizer, wear your mask, and travel, open windows in any vehicle you can, and keep travel to a minimum.
And on the day, what can we do?
So ventilation, wearing masks whenever possible, reducing the period of time that everyone is sitting indoors in a room together, wiping down surfaces, maintaining good cutlery, glass, cup, mug discipline, not immediately, if someone's just had, I was talking about this with my brother, if someone's just had a sort of very prolonged steamy shower, not immediately going in after them, trying to ventilate rooms, and trying to keep all that close contact down to a minimum. So you can still, if someone brings COVID into the boat, if someone is there with COVID, maybe they're asymptomatic, it doesn't guarantee everyone's going to catch it. And by continuing to wash hands and wipe surfaces, you really reduce that risk. We're going to be wearing masks with my family in our bubble indoors for some of Christmas.
Wow. Okay. Well, and if you're saying that, that's because you're taking it seriously. So it's a good advice for others too.
I don't know that I've had this virus. I know that when my brother had it, he seems to have a very long-lasting heart problem following it, and so I am being really careful that I don't get it. I don't want to get this. Ideally, I don't want to get it ever, and that may well be possible because there is a vaccine, we hope, in the pipeline.
Well, Professor Robin Shattock, our specialism is immunity and infection, so perfectly qualified to talk about this, COVID in all sorts of senses, and you're the lead as well in developing Imperial College's vaccine.
That's
so
right.
First of all, how's it going?
It's going well. I mean, lots of challenges, but we are really accelerating, exploring how this vaccine works, and we are finalising what dose we want to take forward. Of course, it's one of many vaccines, and we need as many vaccines as possible to ensure that there's global access for vaccines against COVID-19.
It is extraordinary, the fact that things have come good so quickly on several different projects. Were you surprised that results came through? Because this is something you've been working on for such a long time. It's wonderful that it has, isn't it?
Well, if you were to ask me, what were the chances of success in May or June for any individual vaccine, I would have said that they had about a 20% chance. And that's because for other infectious diseases, it has been really, really difficult. So it's amazing in some ways that we've already got 3 vaccines that have been shown to work. We set the bar at 50%, and they're all above 50%. And as we go into next year, I'm sure we'll see more and more. So this has been a great success story, but also a great relief that actually it wasn't a story like HIV, where we've been spending 30 years and still struggling to find out what would protect you against infection. So a really good news story.
The speed of development for teams like yours has been breathtaking. Obviously not quickly enough for some who've lost their lives and some who've been seriously affected, but in medical history terms, it's been hugely quick. That, of course, then leads to people having concerns about its safety. How can we feel confident that not just at the time when we're immunised, but in months, years, decades down the road, there won't be some kind of comeback for having a vaccine that's been brought to the table so quickly?
I mean, I can understand people being concerned about safety because of the speed. And if you're not living in the world that I live in, you don't necessarily understand what has been achieved. Although the science has gone very quickly, these vaccines have been studied in tens of thousands of participants. That's the same number as you'd normally study over a period of 5 years. So it hasn't been, there hasn't been less scrutiny of the vaccines. It's just been done in a faster period. And people need to understand that most side effects, serious side effects, occur between the weeks or maybe a month of getting a vaccination. So 20, 30,000 people have been studied for each individual vaccine. We know that there has been no serious consequences of the vaccine in that period of time. Now, it's impossible to rule out that when you get to 10 million, 100 million, even larger numbers, that there may be somebody who has some genetic phenotype that may mean that they have a more serious event due to vaccination. But if they have that kind of underlying issue, the risk of having a more serious consequences of COVID are even higher. So it's about a risk-benefit ratio. No medicine is without any risk at all, but the risk of contracting COVID-19 and having a serious consequence of that is so much higher than any potential risk from a vaccine that in ways it's a fairly easy judgment in my mind.
The new technique that you've developed to create this vaccine has done away with some of the things people fear about vaccines, which is either a little bit of the live illness that you're being given or sort of a version of the illness. And this is very different, isn't it?
Yes, so the type of vaccine that I've been working with is based on an RNA approach. That's using a genetic sequence to deliver the vaccine, so it hasn't had to be grown in cells, it hasn't used animal products, human products, it's completely non-infectious. The same is true of the Oxford vaccine, that is non-infectious. So these vaccines are safe to use in people that might not be able to have a live vaccine. So the type of vaccines that we've used in the past, where you take a virus and you attenuate it so it does replicate but doesn't cause disease. These are even safer because they can't cause any disease, they can't replicate. So
you're not being given, to put it in very layman's terms, you're not being given a little bit of COVID in order for your body to produce the antibodies.
No.
It's nothing like that.
So you're not getting the virus at all. What happens is you're just taking the sequence, the code for the protein that sits on the surface of the virus. So when you see those pictures of the virus, it has all those little spikes, what we call the corona, and that's why it's called coronavirus. And you're just expressing that surface protein and the rest of the virus isn't there. And it's that bit that sticks out that the immune system needs to see.
And then it can react to and produce the antibodies.
Yes.
I mean, there are people that are very concerned about vaccines, aren't there? And people, if they feel rather fragile, think, oh, the last thing I want is a vaccine on top of that. So what would you say to people who are concerned about vaccines?
I think, first of all, I would start off by saying that actually when you look at vaccines as a whole, they have been the most impactful intervention against infectious diseases globally. So next to access to clean water, they've saved more lives than any other intervention.
The problem for some people, though, is that is a global public health triumph, but for the individual, they still perceive risk.
So at an individual level, most adults have had many, many vaccines and have forgotten that they've had those vaccines and they've been safe. On an individual basis, we're so used to not seeing disease that we only see the side effects. And you need to, again, make this balanced judgment. What is your risk of disease versus side effects? The side effects of these vaccines seems to be extremely safe. Whereas if you made a list of the side effects of getting COVID-19, they're really very dramatic. And even if you're a young person who may think you're not really at risk, we're seeing a number of people who are getting long COVID symptoms. They may have had mild symptoms initially, but then it has long-term health implications. So I think what people will see as the vaccines are rolled out is, sadly, we'll start to see stories of the person who didn't have the vaccine, who declined the vaccine, who ends up being in hospital, who ends up being really sick. And by then, people will see that it may be too late if they haven't had the vaccine the first time around. I think people want to ask, do you want to be the individual who ends up in hospital or ends up having long-term consequences of COVID-19 because you've avoided the vaccine for this very theoretical risk of a side effect, whereas there's a very, very real risk of having serious health consequences of COVID-19.
Dr. Sarah Filson, lovely to meet you. I know you're a specialist in infectious diseases and have also been working directly with patients in the context of COVID as well. So you're at the very sharp end of those who've got it severely, but very often we know that people with more mild cases can still feel very ill, and actually a mild case of someone vulnerable can be disastrous. So what would your advice be, having seen the devastation of COVID, if you like?
The reality is that the disease doesn't care about the fact that it's Christmas. It is still present within the population and will still continue to be transmitted during this period of time. So we need people to be safe and sensible. We're seeing young patients who have ongoing fevers, ongoing fatigue, ongoing brain fog secondary to the infections itself. And then there are people who are kind of not necessarily people I would consider old or vulnerable, so kind of people from their maybe late 40s to 60s who are actually coming into hospital, and they may have things like mild comorbidities such as diabetes and hypertension, but yet they're coming in very unwell, still quite sick with the infection. So I think the important thing to do is to try and stay safe over this period of time. what
would you advise people that said, I want to see my family at Christmas? What is the best way to protect myself and to protect them?
So I think the important thing to say is, obviously, if you have any symptoms, then don't see people. You need to self-isolate. That's the first thing to say. If you are going to see people, it's important that you try and keep a safe distance, meet them in well-ventilated areas. So whether that be outside if you can, or if you're going to be indoors, make sure that there's a lot of ventilation and that you're keeping a safe distance. It's also really important to do things like wash your hands and all of these little things. It's kind of the addition of little things that make the risk of transmission much smaller, and I think that's really important.
How hard is it trying to convey the message of how devastating it is to people? Because as you say, for a lot of people who don't know someone who's had it, or if they've had it very mildly, they don't see the frightening sights that you see on the wards, do they?
No, and I think that's very tricky, because even as somebody who sees it, sometimes you kind of forget about how bad it is. You maybe might not be at work for a couple of days, and when you come in and you see somebody who's really unwell with it, and it just reminds you of how devastating the disease is. Seeing people on ITU, on HDU, reminds you of how devastating the disease is. But I think The thing to say is that it is real. We have seen patients very unwell from it. Unfortunately, we've seen people from Black, Asian and ethnic minority backgrounds disproportionately affected by the virus. And this is real. It's not something that we've made up. And unfortunately, there has been a lot of misinformation online and on social media. I see it all the time. I often find myself having to combat it, even with friends and family.
People are really looking forward to seeing family members and people that they haven't seen for such a long time in that small window around Christmas that we hope we have. Is there a cautionary note that you could leave for people, you know, in terms of mixing in that way?
I think there is, definitely. I mean, the science is clear in regards to this. The virus hasn't gone anywhere. We know that people are really keen to see each other at Christmas. However, I think there are things that we can learn from some of the other communities who've had special festivals during lockdowns, such as, for example, Eid and also Diwali, that have all gone past and been in lockdowns. I think these communities have actually adapted and worked really well in order to try and reduce the amount that they interact with other people, and have made ways in which, for example, things like booking times at temples as opposed to all going at once, or celebrating as a family at home or within their local community. They've made adjustments in order to ensure that they stay within the rules of the lockdown. And so I think there are ways in which we, as a community, as a whole, can kind of adapt to ensure that we reduce our risk of transmitting the virus.
And it's a special day for many, an opportunity to be with love, but we have to hope and keep people safe so that we have more days in the future, more Christmases and more opportunity, don't we? Well, it's lovely to have you here. Dr. Clare Gerada, you're a GP, Medical Director of the NHS Practitioner Health Programme. A huge history of being fabulous, including being the college's first female chair for 50 years. So you're massively qualified to talk about this, not least because you've had COVID yourself, one of the very early people to get COVID. What was your experience of it?
I have described it as the worst illness I've ever had. And in fact, it was the worst illness I've ever had. I'm not normally ill, I have to say that. But it wasn't just the temperature, it was excruciating pain in all of my muscles. It's as if I'd run the marathon, and I have run the marathon, so it felt very similar to that every single muscle, including muscles I never even knew I had, were aching. And if I hadn't been a doctor, I would have thought I was having a heart attack. So much was the pain on my chest. And at one point I have also said this, that I would have rather cut off my legs than experience the pain I was having.
You were feeling bad for 4 days. There is a different pattern though, isn't there? Some people feel after 4 or 5 days they start to feel better, because even though it felt miserable for you, it is a relatively mild case of it. Others, after 4 or 5 days, things sort of go through the roof.
Yes.
There's almost various names have been given to it, haven't they? The storm and all of those things. But people who've had it and recovered talk about it going through the roof. If you're in that situation, you're caring for someone like that, it's going to be quite a while that you have to be looking after them, isn't it? So how do you best do that? They might start to need food and all of that.
Exactly. Well, it's called a cytokine storm, and it's where your body goes into overdrive to try and sort this infection out, and really is beginning to damage itself. And I think that happened slightly to me, because on the 4th day I got terrible pains, and I think that's what you get with it. The most important factor I would say to people, there's 2 real things you need to keep an eye on. One is fluid, and the other is breathing. And the fluid, it's so easy not to drink when you're ill. And I realised that when I was sick, I drank about 100 mils in a day, which is not enough to keep your kidneys ticking over. So keep the fluids up. When I got slightly better, I asked Simon to bring me some chicken soup, which is the best thing you can ever have. The other is the breathing. And I would actually advise everybody to get a little oxygen monitor, which you can buy really cheap on the internet. You can get it delivered within 24 hours. It's much better than a thermometer. It means you're able to see what your oxygen saturation is. You're able to see any decrease in it. It's a much more important measure of anything than temperature, than blood pressure, than anything. So, but in the absence of that, what you're actually watching for is whether the person is able to talk in long sentences, whether when they get up, they're breathless. Worse still, and hopefully not, whether they're blue around the mouth. But really, those are the two most important symptoms to watch for.
So when's the moment when you think, right, we've got to go to hospital? What's the moment when it changes from misery to emergency?
Yeah. I think when is the moment that you feel so anxious that you need to seek outside help, whether that is to ring 111, to ring the GP, or to call 999. And this is what I always advise parents of small children, is that you're not a doctor. You don't know what your level of tolerance for anxiety is. You're frightened because your child is sick, and in this case you're frightened because your loved one is sick, whether it's your elderly mother or your husband or son or daughter. So don't second guess. If you are worried, that to me is the most important indicator that you need to seek help. Now, maybe when you talk to someone, they'll say, well, can they get up and go to the loo? Can they talk in long sentences? Are they able to, do they look all right? And if the answer to that is yes, then the person giving you advice must say, look, hang on then, ring up in 6 more hours, let's review the situation. So I'm not going to give you any signs to say, ring at this point. If you're worried, that is the point that you should seek additional help.
One of the things that people have felt, and it's a lovely urge, is they don't want to trouble hospitals, they don't want to trouble doctors. Particularly when you first got sick, there was a real feeling of them being overloaded. But you would say, trouble them, ask for the help, because actually they'd rather know than not know.
Now, if you've got one of these machines that measures the oxygen, it's a lot easier, because we can then say, what's your oxygen saturation? You say it's 99, we can be slightly reassured. But just ring. I mean, we'd far rather that was the case. And again, I use the example of mothers with children, but I was on the phone for a lot of people with COVID early on in March and April when I was better and went back to work. If in doubt, ring. There's nothing, it's not embarrassing. At worst, we'll say, look, everything's fine. At best, it might be, listen, you need to get into hospital, or we need to do a visit, or we need to seek some additional help on this one.
Someone now. So if you suddenly found that a family member was showing symptoms, what is the best way to tackle that?
And that's a very good question. If a family member's showing symptoms, it's probably too late by then if you've actually been around them. The thing about Simon and myself is that because I'd come back from New York and was jet lagged, and he was out and I was out, we never actually got close, so to speak. If you've been close to a family member and they're showing symptoms, then I think you have to assume that you're going to get it. So you're going to have to isolate. You know, if this is happening over Christmas time, then you're going to all have to make a decision as a family whether you just stick it out, stay in your bubble, see it through, or whether, you know, you have to go home and isolate at home. But if you do go home, then you can't use public transport, you have to use a car, and you can't use a car if you're sick. So all of these will need to be factored into your decision. My sense is if you get this and you're all ill over Christmas, a bit like I was sick with chickenpox with all my siblings, you just have to sit it out with each other as a bubble.
What we're looking at is a Christmas where we now hope that we'll be able to have some contact and some seeing of our families. I suppose what people are thinking of is what is the best way to manage that Christmas to keep vulnerable people safe. And also, you know, to still feel that there's some warmth there and some joy along the way.
Each family needs to make their own decision. If this is Grandma's last Christmas and she wants to hug her grandchild, a newborn, you have to make that decision. And what I really think is Grandma has to make that decision, really. If you've got a terminal illness and this might be your last Christmas, you make that decision. Listen, I think have as much fun as possible. You've chosen to be in your bubble. You've made that assessment. If somebody is really unwell or really elderly and wants to stay apart, they can stay apart. I think people are going to be very sensible. I really hope they enjoy themselves. And I hope the children enjoy themselves, because the children have had a bad enough year as it is, with their school disrupted, not being able to see their friends. And I hope that the kids really have a good time and go out in the park and ride that new bicycle that they got on Christmas Day. But shh, don't tell them I told you that.
Oh.